Thank you, and welcome to Best Practices in Mental Health, Practical Steps to Reducing Stress. It's really great to see you all here this morning, and we look forward to providing this education for you this morning. Next slide. Today's learning objectives include understanding barriers to mental health access experienced by agricultural workers, becoming familiar with best mental health practices from clinics. We'll also get an opportunity to practice some simple, practical stress reduction exercise that can be shared with agricultural workers and utilized yourself for your own personal betterment, and then becoming familiar with a wide array of mental health resources. Next slide. I'm Theresia Lyons-Clampett, the Senior Program Manager for the Migrant Clinicians Network. Our mission is to create practical solutions at the intersection of vulnerability, migration, and health. That's because we envision a world based on health justice, equity, where migration is never an impediment to well-being. Next slide. You can see here that we provide training and technical assistance for health centers, health departments, and other healthcare delivery sites, utilizing online seminars and learning collaboratives, on the ground trainings, resource development, and advocacy. And you'll note here that we are located across the United States, with our main offices in Austin, Texas, Chico, California, and Salisbury, Maryland. And then we have an office also in San Juan, Puerto Rico. Now I'm going to hand this over to my colleague, Rebecca Young, who will tell you a bit about Farm Worker Justice, our partner in this project, and then we'll get on to the training. Thank you, Rebecca.
Sure. So hi, everyone, and thanks so much for joining us today. I'm Rebecca Young, the Director of Programs at Farm Worker Justice. We are a national nonprofit based in Washington, D.C., and our mission is really to seek to empower farm workers and their families to improve their living and working conditions, their immigration status, health, occupational safety, and their access to justice. We have a diverse and multifaceted approach to accomplish this mission. We engage in litigation, administrative, and legislative advocacy, training and technical assistance, coalition building, public education, and support for union organizing. Next slide. We have a number of resources that you're able to access via our website. We have a lot of different training of trainer curricula, popular education materials, in addition to issue briefs and fact sheets. Next slide, please. And here with us today, we're honored to present Daisy Marino, who is with us from Vista Community Clinic in California. And she will be one of our speakers today, presenting on the amazing work that they've been doing in mental health. So Daisy, I will go ahead and turn that over to you.
Thank you so much. Hello, everyone. Daisy Marino, as Becca mentioned, I am from Vista Community Clinic. I am representing also my colleague, Geraldine, who unfortunately cannot join us for today. She was very excited. However, she had to take some time off today at the last minute, but it's very excited to be amongst you all. And hopefully what we share with you today is helpful for some of you that work with farm workers or community health workers or promotores in your community. If we can please go ahead and, yeah, thank you. Our mission at Vista Community Clinic is that we are always looking to advance community health and hope by providing access to primary health services and education for those who need it the most. A lot of our population are Latinx community, as well as low income. A lot of the programs that we serve under migrant health is farm workers and migrant workers as well. And our vision is that we could create a community where everyone chooses health. If we go on to the next slide, I always introduce our program as as a health promotional department, but which is now known as the community health. But we also have a clinical arm within Vista Community Clinic, and under the clinical arm, we have a variety of services from family services to pediatrics, to also dental services. And we have, as you can see on the screen, different locations here in North County, San Diego, and California. So this is the clinical arm. And then on the next slide, you're gonna see the program that I am under. So Geraldine and I are under the Community Health Department, which is the promotional arm of Vista Community Clinic, in which we look to engage patients and community in health and wellness. Under Community Health Department, you see a breakdown of 3 different programs. I am under the community outreach. So a lot of our work is providing or connecting community to the services and the programs that our clinic offers, as well as providing support for food distribution, diaper distribution, also HIV prevention, which is another department within community outreach. And then there is migrant health outreach, as well as mobile services. So a lot of us have a really strong presence in the community. A lot of us are frontline workers, providing and delivering and responding to a lot of issues and a lot of the need for services in the community, specifically during the pandemic, which we know that a lot of it increased. Moving on to the next, under community health, we have a lot of our work is from the social determinants of health scope. So we look into at the bigger picture, right? So what are some of the things, or what are some of the factors that are affecting a community member, that is making it very challenging for them to have access to resources? And we know that a lot of it sometimes goes from, circumstances with their families to very systematic factors, right? We also work with multiple community agencies, with community members as well, so that we can, and any of the services that we deliver are from a community center approach. So making sure that we are being intentional about the work that we do, and also engaging those who are mostly affected, right? On the next part of this, we can go ahead and move on. We do have, under the migrant health and outreach team, we have this hybrid model where a lot of our staff are not only providing clinical support, but they're also wearing multiple hats. We also have community health workers as BCC staff. So a lot of us, once again, are frontline workers. And we work closely with community leaders. So a lot of our projects are grant funded, and a lot of the community leaders that joined us in these efforts are provided a stipend through, some of the grants that we apply for. And of course, that also allows us to provide them trainings with and opportunities that they could, add onto their professional development. If we can go on to the next one, please. As I mentioned, a lot of our programs are grant funded. So currently we receive federal grants, or also county grants, local grants. Sometimes depending on, the project that we want to deliver in the community, and thinking about, all of the past projects that we have been working on, our experiences in the community is how we're able to identify, which grants are the ones that we could apply for, and how that could benefit, or that could be added into the work that we're already carrying out. And this is what I meant when I said that sometimes when we apply for grants, we look into those that are specifically, or that have a component of community health workers or community leaders, because in that way we also want to be mindful that we're also being able to provide a stipend for the community leaders that also volunteer their time into our projects. Can we go to the next one, please? Thank you. And one of those grants that we received last year, it was through the MSO Act, so the Mental Health Services Oversight and Accountability Commission. And in this grant, we partnered up with, it was Vista Community Clinic, and it was also the Latino Coalition for a Healthy California, as well as the County of San Diego. And the idea was that we wanted to create listening sessions in the community so we could hear from them what was the conversation about mental health, happening in their communities. What were some struggles or factors that was affecting their community. So as you can see on the screen, we engaged a total of 32 participants, and a lot of them are from the Latino and Migrant Indigenous residents here in San Diego County, specifically in the North Inland and Coastal region in San Diego. And we wanted to hear from them, from their emotional well-being and their mental health. Once again, what were some factors that were affecting them? If we continue to the next one, we're going to see that some of the findings that we came across is that there is a huge mental health stigma, something that is not spoken about in a lot of their households. One of the comments that just sticks with me from this surveys and focus groups is that a lot of them, some of them were young participants, and they expressed how at their households, the idea of expressing like I'm feeling depressed, like that's not something that really resonates with the family, and instead they're thinking that you're just being lazy, and some other things that they were speaking about how there's a huge stigma going on, not only culture-wise in the community, but also at home. There's also a lot of language barriers, so it's very difficult for a lot of them to have access to mental health resources when they either are monolingual Spanish speakers or they only speak an indigenous language. A lot of lack of resources, or having access to insurance barriers, or having unclear mental health services process. A lot of the families that need mental health or behavioral health resources need to be referred by their primary care provider. And a lot of times there isn't that close communication between the family or the patient and their primary care for them to be referred. So there isn't a clear process for them to follow, or that they are able to understand because of other barriers that I just mentioned. And of course, COVID-19, right? That isolated a lot of families. It made it very difficult for them to, prioritize their mental health when there was a lot of other factors affecting it, right? Like financial instability, right? Emotional grief, and a lot of other barriers that just made it very difficult. So a lot of that, came as a finding from the study. Can we go to the next one, please? And, this is not to be surprised that also in this mental health findings, we found that there was a lot of fear also from a lot of participants. And a lot of it revolves around the fact that San Diego is very close to the border with Mexico. And so some of the participants, are either going through an immigration process, or, they're undocumented. So as a result of that, there's a lot of fear and uncertainty as far as, planning ahead, right? Living in limbo and a lot of other circumstances. And the fact that, they live in this region where not only is getting expensive here, but it's also, very, very in close proximity to the Mexican-US border, and just border patrol and all these other things that, like I said, systematic factors that are really affecting their mental health. Moving on to the next one, we some of the outcomes that came out of this MSOAP project is that after engaging the community members into participating and providing what was their take on mental health, or if they knew what mental health is, right? The team that was the Vista Community Clinic team that was part of this project, they were asked to present their findings to the County of San Diego's mental health services, and the idea was that they were going to inform their 3-year expenditure plan, because the County of San Diego wanted to prioritize, or wanted to find what were some areas that they needed to prioritize with their services. And given that they were aware about this project that we were supporting, and about the findings that we came across, they were very interested in that, and they asked that our team members presented this findings to them so that it could inform their expenditure plan. As well as, given once again this project, the team also decided to start hosting annual mental health fairs as a way to bring multiple resources into the community, sort of like a one-stop shop where we will be collaborating with multiple agencies that offer multiple services, because once again our approach is from a social determinants of health. So we know that in addition to mental health or factors that affect mental health is not having access to other resources like medical appointments, or rent assistance, or anything else that really affects their stress levels. And in addition to that, given that the team realized that there still continues to be a lot of mental health stigma in the community, we started conducting mental health community presentations to parents and families to start that conversation, right? To really ask, what they think about mental health, or what they think mental health is, or if they know what stigma means, right? So if we go to the next part of this presentation, we're going to see a few pictures from a mental health presentation at a community conference. A lot of them are parents, and in this presentation, we're seeing a lot of engagement from participants. They were given a lot of different activities, so where they were able to express and really think about what mental health is, or what are some of the things that or what are some conversations that they're having at home, or that they could start having at home with their families, with their children. What are the feelings that where, depending on for instance, or maybe backtrack a little bit, one of the activities was asking them, I think the team played three different songs, and after playing each song, they stopped the music and they asked participants, what did this song make you feel? Why, or where do you think it's coming from? So small activities like that really gets that conversation started, and really makes the participants think about their feelings, think about their emotions. And a lot of them, when they were expressing their emotions, they reflected on something. I'm feeling this way because when I was little, growing up, I went through this experience. So, that gets the conversation started with the community, and that is also creates the space for them to learn about mental health. And little by little, they start empowering themselves and advocating for also their own mental health, for there to be mental health resources also for them available. So, it's little by little steps. And I know that we're still very far from, really addressing this whole mental health stigma. But I think, starting with that little step, I think eventually is going to lead to somewhere little by little. On the next, we thinking about the mental health fair that I mentioned earlier. This is the first mental health annual fair that took place last year, right after the MSOAC project concluded. So right after the listening sessions and the findings, the team hosted a mental health fair where we partnered up with multiple agencies, and one of them was Kaiser. And Kaiser has a team of physicians and medical students that came to this event, and they provided one-on-one consultations for free. Also, all of the resources were free. So it was one-on-one consultations. It was also vital, so blood sugar screenings. In addition to that, at this event, we also had our own BCC mobile unit, which was providing free flu vaccines as well as COVID-19 vaccines. In addition to other agencies that were also, promoting their own services and resources, but also ensuring that a referral process came from that event. So anyone that needed a follow-up, was schedule an appointment, either with their primary care for a follow-up, or, with any agency here present that, could better support them or assist them in, anything that they needed support with. So once again, it was kind of like a one-stop shop where there was there are multiple resources happening. And this is the first annual mental health event. And this year, in June 24th, we're going to be hosting our second annual event. And the hope is that at this coming event, we can include other services and we can expose community to other resources, such as pet therapy as well. So the team is looking into different ways of exposing other ways of coping or other ways of supporting communities' mental health. Moving on to the next one, and this is just to recap everything. I think that's something that we have learned through not only this particular project, but thinking about or reflecting about past experiences too. We always make sure that we're learning from the community, so that we're better understanding what the needs are. And that as we do that, we're also connecting them with existing partners. Mental health is just, like I said, one of the many barriers and challenges the communities face. And we know that at Vista Community Clinic, our services only cover, so much, right? Like there is a lot of other areas that families will be better assisted if it was through another agency or another partner that could better support that. So we make sure that we're always referring them to the appropriate agency for that. We also ensure that we're working with county and government partners, such as this MSWAG project was an opportunity for us to engage county partners to make them part of the conversation so that they also hear firsthand, what are some programs that maybe are already in place, but maybe they're not working, right? So by them hearing about, the challenges that already exist, and the fact that it's very difficult for some of those programs to be accessed by community because of multiple barriers, right? By them knowing that, it already makes them think about, okay, we know that this is not working, so we want to ensure that it's working. So, please, advise what are the changes that we should make. So that's where the team comes into place and providing that feedback and joining those county meetings, that to better assist that process. We also have trusted staff out in the community. So a lot of us that work in community health, we are part of the community, we come from the community, and a lot of what, in addition to the individual skills and, personal skills, we also bring very unique personal experiences into the work. And something that the team always reflects on is how whenever we are assisting a community member, we always think about, oh, this could be my mom, this could be my dad, right? Like also trying to navigate the services. So always, building those connections and that familiarity with the community. Working with trusted messengers. So those are the community leaders that I mentioned, right? Engaging them in the process and welcome their feedback and making sure that there is a space for them to express, what are some things that are not working and how those should be changed. And that constant community presence is very, very, very important. Currently, as you can see in the picture, those are our dental and mobile unit. On a daily basis, they're out in the community, either at a community park, at a church or a community center, or at schools, connecting with the community and ensuring that they meet community where they're at, right? Instead of, waiting for them to, come to our clinical centers for an appointment, we're out there trying to minimize that barrier in repetition, right? Like if they're going, for instance, if the mobile unit goes to the park every Tuesday, so we'll make sure that the next Tuesday, they're also there once more, as a way of bringing resources into the community and as a way to also continue providing that one-stop shop for a lot of the members that benefit from our services. And I think this was the last part of the presentation. The next one, it just shows our contact information. So if we can please display that, Martha. On the next one, you're going to see. Oh, I'm sorry. I think I was a little confused, but I'm gonna add my contact information into the chat so you all can contact me if have any questions about any into what was mentioned today. And for now, I'm gonna pass it to Pam and Jessica, who are gonna share with us practical steps for reducing stress.
Daisy, before we pass it on,
Yes.
we did have a question in the Q&A. Somebody asked, and I'm going to read the question. I'm interested to
Yeah.
know what best practices, questionnaire, or information was shared when doing community outreach and community presentations.
Right. So I'm going to answer the question from the M2R project that I mentioned. When we were collecting responses from the community, or when we asked them to participate in the listening sessions, we asked them once if they knew about any mental health resources in the community. And if so, we wanted to know what was that mental health resource that they had heard about, and also what was working. So for instance, if they say, oh yes, I am aware that through that my provider can refer me to behavioral health, right? And then so by them sharing that, then we then ask, is that working well, or what's working or what's not working? And a lot of the feedback was, the referrals process is very lengthy, so it takes a lot of time. Or the referral was in English, so that was very hard to really understand and follow. So things that would let us know what was working and what was not working, so that we were able to identify what were some best practices in that, as we were navigating that with the participant.
Thank you, Daisy. Daisy, we also have some other questions, but I'm going to hold those to the end. And I also wanted to let you know that we do have your contact page towards the end of the webinar, so that
Yes.
folks will get that in our follow-up email. Thank you.
Thank you very much.
Go ahead,
Hi,
Pam.
my name is Jessica Calderon, and today I'm presenting with my coworker, Pam Cicada. Thank you, Daisy, for the great information you were sharing with us. And we're going to switch to talk about well-being of the healthcare workers and services who provide at the front of the patient care. Healthcare workers witness the suffering and troubles of the services of the daily basis. Not only they witnessed the suffering of their patient, but also their own trouble. When that becomes too much, it can become a little bit overwhelming. We need to pay attention to that, and we need to figure out for ourselves, what is it that I can do to take better care of myself. So we're going to start with what is self-care. I'm going to invite you guys to add on the chat what is one thing that you like to do for yourself for self-care. And while you do that, I'm going to continue saying that self-care is anything that makes you happy. Self-care is increased strength of resilience. And also a lot of people tend to think or assume that self-care activities need to be expensive or to take a lot of time. And that is not true. It can be something free that you like to do, something that it can be done in a few minutes that makes you feel better. And especially we want to emphasize that self-care is not selfish. If we want to move to the next slides, we're going to review a little bit about self-compassion. And what is self-compassion? Self-compassion is being kind to yourself when you're going through hard moments. Self-compassion is being your own best friend, and to ask the right questions. What am I experiencing? What I need to do in order to feel better? So while we're going through this, that process, is identifying what is it that I'm feeling, what are my emotions, what is it, where is it coming from? And while you process that information, then what is it that I can do in order for me to feel better? And when we mention being your best friend, is because we notice that a lot of time it's easier to offer really nice, kind words to others while they're going through a hard time. But when we're going through those moments, sometimes the expectation is that I need to be stronger. I need to be able to manage all of this. I know what I need to do, right? So be able to offer yourself those same words. And the kind, I think, is understanding that we're humans, we're gonna have all of these feelings, and it might not feel good at the moment, but it's part of growing. And if we want to move to the next slide, a lot of research have showed that self-compassion will help you in a lot of aspects. So there's a lot of benefits of being self-compassion, so why not doing it? It reduces the stress, the anxiety, the shame, increase happiness and life satisfaction, reduce social comparison. Especially nowadays with social media, I think it's really easy to compare ourselves. So be more self-compassion, it will help you. You get to all of the other benefits. I want to highlight the quality of sleep. We all know the benefits of sleeping a little bit more, but having the quality, I think, is very important. Sometimes whenever we're under a lot of stress, it's hard to find that. So be aware of that and those things. For our next slide, the grounding techniques. There are a lot of grounding techniques out there that you can try and see which one works best for you. I will suggest to try as many or all of them if you can, and figure out what are your top 3, maybe your top 2 that work best for you. That way, whenever you need them, you know that this one is probably going to work for me. And if this one didn't work, well, I have another one that I can move on. I'm one of those person that likes to drink water. I'm always going everywhere with my bottle of water. And I'm always reminding people I like to stay hydrated, all of the benefits of staying hydrated. But I think for me is the aspect of, while I'm drinking the water, I know that I'm helping my body to stay hydrated, to do well, to be more aware. The other one that I like to do, for example, is the sounds. Here at my desk, I have this thing where you're just gonna produce a little bit of noise, right? A little bit of sound. And to me, closing my eyes and just doing it maybe 3 times and practicing my breathing techniques. So I'm combining two grounding techniques. It kind of helps me to feel better. We want to remind you that the purpose of grounding technique is to allow you to step out of those negative thoughts, those problems, and give you like a new reset, if you want to put it that way. Our next slide is, thank you, Marta, is the things that we can do in a short period of time that will make us feel better. And is to help someone, right? Maybe we're helping all the time. Maybe we don't need to go for that one. Maybe and that is part of our work, right? So maybe set up a goal, and maybe having, maybe jumping in the same place. If you're able to do some jumping jacks, do 5. It will make you feel better. Having a quick nap, give or watch a hug. I'm one of those that I'm always like asking for hugs. My family is to blame for that, but definitely makes me feel better. Writing 2 things that you're thankful or grateful for. Some people like to do this one at night, but honestly, you can do this one in the morning, afternoon, at any time of the day. Going out for a quick stretch and coming back, that also will help you. And for my next slide is small goals. Your brain a lot of time doesn't know the difference between doing something really big, accomplishing something really big that you need to do, or the small task that we all have to do. So if it helps you in the morning, just writing, okay, today I need to have breakfast, shower, and get ready, and maybe leave home by this time. By the time that you're doing your checks, your brain is going to start feeling, well, your body is going to start assuming that you're getting a lot of things accomplished, right? So the endorphin is going to be released and you're going to be feeling better. So a lot of time is not only focusing on this big project that I need to accomplish, to finish. So also It's part of being nice and kind to yourself, right? Those are things that we have to do. And now I'm going to pass it to my coworker, Pam Sequeira.
Thank you, Jessica. I'm happy to be here, everyone. Hello. There's a lot of research recently on just how effective and efficient expressing gratitude is in helping us feel better, whether it's a small, minor event or a monumental, giant event. Expressing gratitude at any kind, at any time, stimulates positive hormones and then produces us significant physical, emotional, and social benefits. And it's important to recognize that it's not only helping us, but it's also helping us, everyone around us. And why is that? Well, it helps us cultivate a community of compassion and kindness, and that is contagious. Next slide, please. And connecting to nature is another quick and easy way to feel better. Turns out that spending time in nature reduces stress and increases empathy and attention. And really, if you don't have access to this, even just looking at pictures of green spaces or blue spaces can definitely help. This is a picture that our director, Dr. Weingarten, has on her laptop that she uses, and she's on her computer a lot, and so it's on in the background. So she, sometimes she just takes the time to notice it, and it helps. Next slide, please. Thank you. So sleep is a fundamental aspect of our well-being, but then like Jessica said, it's often neglected. Quality sleep is. So research has shown that sleep plays a crucial role in our physical and mental health. It affects our cognitive abilities, our emotional regulation, our immune system function. And there are many ways to incorporate healthy sleep habits into our daily routine. A couple are getting up at the same time, engaging in physical activity, and turning off devices before bed. And at W2W, we actually have a resource available on our website of healthy sleep habits that you can access, and we can share at the end as well. Next slide. So the AH method. The AH method is an innovative approach to enhancing well-being. And this is also a quick and easy way. It involves pausing, fully taking in and appreciating what's around you, what you're seeing, what you're hearing, what you're touching, the smell, and even using your imagination. And like I said, again, this is just another quick and simple way of feeling better. Next slide, please. So Eager and Amster, who write about the AH method, wrote a book about their research. And they said, after practicing the method, the participants reported a reduction of negative mental and physical symptoms. Next slide, please. Richard Sima, who is a neuroscientist who coined the term joy snacking, and that is experiencing little bursts of happiness by finding those small moments in our everyday where you can really engage with something that brings you joy, the feeling of being connected and happy. I know I do this all the time just by looking at my dog, watching him sleep, or being cozy on the couch. That always just really sparks some joy in me. And so the research shows that finding and really engaging with joy can be a way of consistently cultivating a good, meaningful life. And this is just a short clip on another tool that we can use, cyclic breathing or sighing. And if we can play that for folks, sorry, there should be an audio.
Sorry, Pam, I don't think that this is embedded in the slide.
Okay, sorry about that. Well, this will definitely include it into the email at the end. But again, it's just another way of using your breath to slow down and regulate your emotions at the time. It's quick, just a couple minutes of doing. And like I mentioned with the sleep habits resource, we also have one of a daily practice to restore equanimity, to restore that calmness in our bodies. And again, we have additional resources for clinicians, community health workers, providers on our website. On the next slide are just some examples of that, of some of our resources that we have. Thank you. And this is our contact information. I'm Pam Sakata. I'm the program manager with Witness to Witness, and I presented with my colleague, Jessica Calderon. And it was a pleasure to chat with you all.
Thank you both. I would like for each of you to take just a moment to scan the scan code for our evaluation. And if you're unable to scan that code, we will send a follow-up email with the link in so that you can give us your feedback. We really value your opinion, and we use that information to provide updates and to improve all our educational offerings. So I thank you for that. Next slide. This is the question and answers portion. So we'll back up a little bit, and we'll talk about some questions that came in and get some answers from you. Desi, Lillian Rodriguez said that you were absolutely right. The challenge was met today is helping other agencies and services deal with language barriers and being able to communicate with those who don't speak English. Most from their community are Hispanic. What suggestions do you have to help with this challenge?
Thank you very much for that question. I'm honestly gonna say that a lot of what we have done is advocating for there to be interpretation services available in different agencies. Thinking about, for instance, the community leaders that I mentioned previously, they participate at council meetings, and I know that one of the hardest thing was for them to be able to understand that, because those are fully in English. So they advocated for, or they spoke with their council members, or they worked together so that they could, ensure that they were expressing the need for there to be more of like an accessible space for them. And although I don't want to say that they have fully accomplished that, because it has been taking a little bit of a process, but little by little, they are trying to kind of like claim that space and be able to participate in these events where they're able to get interpretation ahead of time. So something that we have done in our work with the county, for instance, thinking about how we sometimes meet, join some of their meetings. We bring all of these findings that we're coming across, and those are, data, right, that we have asked participants or community members to participate and share what their experiences are. And by us presenting that to the county, right, or by us talking about those things with other agencies, we made them see that there is a huge need for those for services and for agencies and either at the county level, or just other maybe CBOs as well, to work with that, right, to either provide some sort of interpretation services, or hire also staff that might be bilingual and might speak multiple languages. So that's what we have been doing, right? And it's a long process. It takes a lot of time, but little by little we do see how some agencies, especially at the county level, we see that they have hired bilingual staff so that they're able to provide assistance to the residents that only speak their native language. In this case, Spanish or any other language that they might speak besides that they only speak besides English.
Desi, do you also ever utilize a translation line or interpretation line?
Our community health department does, whenever we host events or virtual events, we do work with interpreters. So as I said, a lot of our funding is, we are grant funded. So, we also kind of like look into those, that cost also being allocated into the funds that we get, so that we're able to hire interpreters for those virtual meetings where, we need to provide that it needs to be a bilingual space. In the clinical arm, there is a phone line where community members are linked to, so that they're able to get that assistance.
Megan Vecina also asked, were there incentives provided for the participants or transportation to follow up with referred partners?
Right. So once again, our projects, those are the costs that, when we apply for grants, we try to ensure that those are allocated in our spending budget so that we're able to provide gas cards, for anyone that might need it. Or another thing also that we do is within Migrant Health, we also have a transportation service available where our staff is able to provide free transportation to patients to and from the clinic, for any of their doctor's appointments. And another thing is that we also know that medical also, so depending on the recipients, some of them qualify for free transportation, so we ensure to communicate that to the participant, and we ensure to refer them to an enrollment counselor so they can explore that option for themselves. So yeah, we try to be creative, and for the listening sessions, yes, the participants also receive an incentive for their participation, which was also included in the grant.
Wonderful, thank you. Rosetta Dupree said, what are the best practices in approaching and or sharing the rapid revive training to the Latino community? Right.
I think that thinking about the practices that we have utilized, in addition to, like a virtual setting where we're able to, provide that bilingual space. We also do a lot of on the field. So some of the information that sometimes when we need to deliver information about like a new project or findings even for this listening sessions when we had to go back and provide that follow-up, that was done virtually and in person too. So kind of like accommodating to some of the times that would work best for them and the method that would work best for them. So those that were able to join virtually, they did so, and those that were better, able to join in person, we also accommodated to that. So once again, we go back to assessing what might work best for that particular community. Hearing from them what are things and challenges that we need to keep in mind in order to brainstorm as a team and find what would be the best way to approach them, or what would be the best way to deliver any type of information that that they're asking us that they need. So we always go back to assessing first, like asking and hearing from communities what would work best, depending on their circumstances, and then that's how we approach it.
Wonderful. I know from our working together and putting together this this presentation, we talked about this earlier, and I noticed that you did not use the word mental health much in your work with the community. And can you talk a little bit about why?
Right. And one of the things that we also learned as we were delivering or facilitating the listening sessions is that when you ask participants what they think about mental health, given that they're not culturally familiar with it, they wouldn't know what to answer, right? And we learned this also through a different survey that we did during the peaks of the pandemic when we were asking COVID-19, when we were asking farm workers during the COVID-19 what were the effects and the impact that the pandemic was having in their in their lives and at work. And we asked them, we brainstorm about what terminology to use. So we didn't want to use mental health because it's not a concept that they're familiar with. So instead we asked, how are you feeling? allows you, or like what helps you reduce stress, kind of similar to the approach that that Jessica and Pam just shared earlier about how to be mindful, how to think about, and what other terminologies to use, and that's how we were able to gather more insightful responses, or more, they would take the time to really think about that and answer, because every time we said the word mental health, they would always ask, what do you mean by that? What is mental health? Or we're not understanding. So it's something that we have been coming across with. And like I said, there's a lot of stigma around mental health, because whenever we mentioned, the need for instance, therapy, like if we want to speak to the community about our behavioral health resources at the community, particularly the Latino community, they say, oh, but like no one in the family is crazy, right? No one in the family is crazy. I don't think we need that resource. However, the younger generations are saying, there's a lot of stress at home, or we have this generational trauma that a lot of us, now that you're younger, we are realizing, but our families are not speaking about it, because when our parents were small, they also didn't know what these feelings and these emotions that they were feeling meant, and so our approach is, I think we need to start, when we want to start talking about mental health, we want to start from the word stigma. What does the word stigma mean? And having this really small conversations with the community to really gather the input and engaging them in part of this process, so that together we can start having these conversations about mental health, and we can start little by little, we can start acknowledging that all these emotions and all this stress and all these other preoccupations happening is related to mental health. And the mental health is something that we should advocate for resources to be allocated to address that, so that families have more access and more resources that they can benefit from.
Thank you. That's all the questions that we had in the chat. Now, I will welcome any of you to raise your hand and unmute and ask any questions that you might have of any of our presenters today. Have any of you experienced any of these same kind of issues and dealt with them in your communities in any particular way? We'd love to hear about that. Olga says, yes, mental health is hardly ever talked about, especially in the Hispanic household. It's always seen as crazy. So I think that your suggestions, Desi, about how to ask the questions that pertain to what we would think of as mental health in more of a conversational way about how you're feeling and what kinds of things are affecting you or bothering you. So, Olga, if you would like to unmute and talk more about that. Or Luis also says, it's almost like a taboo conversation in Hispanic communities. So I would welcome any one of you to unmute and talk a little bit more about that. This seems to resonate.
I can talk a little bit more about this. I come from a Hispanic or indigenous household. So for us, it's mostly, it's something, I believe somebody mentioned it as taboo, which is correct. We don't really, we hardly even talk about what mental health is, or it's never talked about in our household. It's always seen as, oh, you're crazy, or like, oh, back in my day, there was no such thing as mental health, And I have seen how it is being affected on the younger generation, especially kids, even kids right now. So I think that thank you so much for this presentation. It's something that I will apply, and you know, I'm not sure if you guys can also provide them in Spanish. That would be perfect. Right now with the nonprofit organization, I think that this presentation was awesome, and I think this can also benefit other staff members here with me. But they are Spanish speakers, so if later in the future you guys do provide that, just please keep me in mind. And thank you so much for this presentation.
Thank you, and that's great feedback, and we will plan to do that.
This is Pam. I do want to just say that, you know, at W2W, we like to use this analogy when talking about workplace well-being, and that is, you know, there may be boulders in the road, but you can always remove the pebbles in your shoes. And so I think with Daisy and her approach to mental health in the Hispanic Latino community, starting small, baby steps, right? Like, let's not just talk about mental health, but let's talk first about the stigma. Let's do the baby step first, and that's definitely how I think you're approaching this, which is great.
And Yesenia Cruz says, yes, I love the approach of using stress versus mental health in initial outreach with Latinx populations.
Yeah, and I also want to say, just maybe like I said, as the last comment, earlier during my presentation, I mentioned that we work closely with community leaders. And, you know, they're the trusted messengers. And we know, you know, those of us that engage in outreach work, we know that word of mouth is a powerful tool. So in these spaces where the community leaders, you know, join us for, you know, this mental health conversations and trainings, you know, we're all learning together at the same time. And these are learnings that, you know, they take with them and they share with their families, you know, they share with their kids, they share with their neighbors. And like, that's how we get the conversation started, right? By relying on that powerful tool of, you know, knowing that, you know, when we start talking about these things and we engage those community members into the conversations, you know, we make them part of that, and we learn together, and, you know, they're likely to share that with others. So, you know, I think that we have been making, you know, not, you know, big progress, but I think little by little, you know, we will be getting somewhere.
Andrea, I noticed you had your hand up. Do you still have a question you'd like to ask? We do have another minute or so. Yeah.
Sure. I just wanted to, I'm from UC Davis Center for Reducing Health Disparities, and I wanted to ask if any of you have any experience with providing mental health services via telehealth to farm workers. Our center just started doing a study where we're going out to farm workers, the sites, and starting focus groups with them to and the, you know, the labor contractors and the farmers, to see if that is a service that we could bring out to the field for them. So I just wanted to hear if any of you had done any work in that area.
You know, at Vista Community Clinic, we have, I know that during the pandemic, telehealth was a big resource for the community to access multiple resources in addition to behavioral health resources. But, you know, unfortunately, we came across, you know, multiple challenges, especially with the farm worker community, where, you know, a lot of them live in rural areas. So it was very difficult for, you know, for that signal to be established there, and it was very difficult for them to have that follow up. And so what was that other thing to that? And some of them also have like limited data on their phone. So, you know, that was an additional cost that they had to deal with. So it was difficult. It has always been very difficult to engage them through telehealth. Okay. But it was successful in other cases where, you know, like I said, if there's someone that, you know, if there's a farm market that has a smartphone, or they have better connectivity, you know, and something that we learned is that in these rural sites where a lot of them live and work right now, they all have Cricket as their phone service. And that seemed to always work. So it was very fun to see that amongst each other, they were helping each other out. That they were saying, oh, like, why don't you switch to Cricket, because you have a better service and you're able to have signal through here. So because of that, some of them were able to keep their appointments by looking into what forms of resources or services work best. So a lot of the times comes to that, like brainstorming or like thinking about different creative ideas and how to engage them, and doing those focus groups also for other projects, not related to telemedicine, but all other projects. We have always relied on hosting those focus groups in person, so that we're able to better learn, how to best support them.
Right.
Thank you. Great.
Thank you. And I'm going to be mindful of the time. We are at time. I want to thank you all for joining us. This was a very enlightening training. Thank you to our speakers. And thank you to all of you for asking your questions and being engaged with us today.
And before we end the session, I just want to remind you guys that we will be sending up a follow-up email later today with the links to the recording of this presentation, as well as the evaluation and other resources. So you will be receiving that from either myself or one of our W2W people. So thank you. Thank you all and have a great day.
Thank you.